longer so we can put stuff over here. So we're gonna make this not anatomically correct. Okay, so this is common hepatic. What does this change into? What's the direction?
Up is superior, proper.
So proper hepatic.
Down is the gastric.
Proper splits to right and left.
So proper splits into right and left. Right and left what?
Hepatic.
Hepatic. What comes off the right hepatic?
Cystic.
Absolutely. Which supplies blood to what?
Gallbladder.
All right. Tell me about gastroduodenal.
Superior duodenal.
Okay. So we got a supraduodenal.
Superior posterior pancreatic duodenal.
Okay. So I'm gonna do that. So I'm gonna say this is the. So this is the superior pancreatical duodenal. We're gonna say posterior.
Okay.
And then here's the superior pancreatical duodenal anterior. What else comes off the gastroduodenal? The what gastro?
Right.
So we're gonna call that the right. So this is also called the gastro-omental.
What is the right gastric?
Yeah,
I
is
thought
the
it
right
came off with the
gastric?
proper hepatic.
It does.
So what were we saying?
Right gastric comes off proper.
But you can see it. So you're gonna see it a couple of ways. Because on Morgan's body, you see it coming off of the gastroduodenal. Okay, so remember you can have some variation. I've been putting it off the gastroduodenal, like right when it kind of splits. You almost like see it like right there.
Yep.
Okay, so this is gonna anastomose. Right. So that's the right gastric. Okay. Anything else? So we got the gastric, the supraduodenal, my superior pancreatical duodenals. All right, gastroepiploic.
Yeah, left gastric.
What does that come up?
Splenic. And the splenic, does that also give off the short gastric?
What is that? Yeah.
So the short gastrics, which go to the fundus of the stomach, come off the splenic. What else comes off the splenic?
The dorsal pancreatic.
There's a dorsal. There's a greater pancreatic. There's branches to the tail of the pancreas. So there's a ton of pancreatic branches.
Do we need to know the specifics of those, or just know esophageal or pancreatic branches?
So definitely know the short gastrics, the left gastroepiploid. Know that there are some to the pancreas, the body, the tail of the pancreas. What else comes off the left gastric?
Esophageal.
Esophageal branches. So there are some, we'll say esophageal branches. Hopefully you can see all that. Esophageal branches. Anything else? You think we got it all? Okay. What's next?
Is that SMA?
Come here. So the SMA. Tell me the branches going to the left. What are my branches to the left?
The intestinals.
Specifically, jejunal, ileal. Tell me about my SMA. What's really one of the first branches that's coming off of here? So we're going to say those inferior pancreatical duodenals. So anterior, posterior. Okay. What else comes off the SMA?
Middle column.
So MRI is what I like to say.
MRI.
Iliocolic, right colic, middle colic. And so based on Dr. Rochure's lecture, he said that there were 5 branches of the iliocolic. What were those?
Ascending.
Ilial.
So yeah, the
Anterior,
colon,
posterior,
anterior cecal. He had posterior
and appendicular.
and the appendicular.
Colon is up.
Okay.
Down. Ilial and ascending.
Anything else off the SMA? We good. So what nerve structures around the SMA?
Superior mesenteric ganglion.
Absolutely. All right. What are these that then are coming off?
Testicular or renal.
Oh, right. Forgot to add these the last time. Then we also have our gonadals. So if it's a woman versus a man, depends on what you call it, but if you call it gonadals, we know what you're talking about. Then what do we have? So IMA. What does the IMA do?
So we can say gonadal.
So gonadal instead of saying testicular versus ovarian, because gonads are your gonads.
Okay.
Absolutely. So which one is this?
It's your left column.
So left colic, what does this anastomose with? The middle, to make what?
The marginal artery.
That marginal artery that does what?
Goes around the whole.
Absolutely. So you can have a blockage in one spot and still have blood supply to the other because of this anastomosis. So specifically, what part of the large intestine does the middle colic supply blood to?
2/3 of transfer.
Be specific. Tell me something. Be specific. A little more. Tell me about the flow. So what if we said the right colic flexure and then 2/3 of the transverse colon, approximately 2/3, versus the left colic does the left colic flexure, or we see that as the splenic flexure, right? Okay. What are these branches?
Sigmoid.
So there can be 3 to 5. Okay. What's this one?
Superior rectal.
So superior rectal. Okay. So now we're at the end. What does our aorta do?
It's going to split into your
Into what?
common iliac.
Which then splits into what?
Internal, external.
Internal and external.
What comes off the internal? Okay. What's another one we saw? Talked about today. Comes off the internal. Which pudendal? You say internal. What else? Our gluteals. Superior. Yeah. Gluteals. Absolutely. All right. So then this is my external iliac, which becomes what? Where?
After the inguinal ligament.
This is my inguinal ligament. And then what's the last branch?
This inferior epigastric.
Inferior epigastric. Inferior epigastric.
Yeah.
Yes. Because in that anterior thigh is when we made you, or you guys were instructed to look for the superficial ones. Some of y'all did. But that's it's a done deal. But that inferior epigastric is the last branch off of the external iliac before it turns into femoral.
Does that one ranges before the
Before the inguinal ligament. Yes. All right.
Yeah, I was wondering about that. What about the deep and
the
inferior epigastric?
So the deep, the circumflex, like epigastrics and all that, that was anterior thigh.
Anastomosis.
But it does say in the lecture.
So he talks about it in lecture.
It's in the lecture.
But y'all didn't have to know it for lab.
Yeah, okay.
So that was okay.
All right.
And then
This help?
Yes.
Make sense?
Yes.
Did y'all practice over the weekend?